All right, it's 11:30. I'm really excited to be here with you all today. So today is another session of our Wednesday briefing where we talk about the impacts of the federal budget reconciliation process on Medicaid and SNAP here in Tennessee. So as we've been doing, we use this as an opportunity to update you all on the real-time breaking news regarding what the House was doing a few weeks ago now, what the Senate's doing currently, and what we expect to see downstream, both in Congress and here in Tennessee. So we're informing you, but we're also taking some of the time to hear from you all about what you're doing in your communities to get the word out. Our goal here is to bring you all along in the conversation and give you the tools to make some noise and raise some awareness around the negative impacts of Medicaid and SNAP cuts in Tennessee. Today, you'll be hearing from myself, moderating the conversation, our resident health expert, Gordon Bonnyman. Gordon is a staff attorney here at TJC, but he's also the organization's co-founder, so he has lived this work on the Medicaid side for his entire career and can really speak to what is going on in Tennessee, what we can expect to see in Tennessee should the budget reconciliation bill cut Medicaid. We'll also hear from Signe Anderson. Signe is TJC's Senior Director of Nutrition Advocacy. She'll walk us through what the SNAP program looks like in Tennessee right now, what the threats are at the federal level, and in particular, what we can push against in the budget reconciliation bill regarding SNAP. So we'll hear from Gordon, we'll hear from Signe, and then we'll hear from you all. We'll have a Q&A portion to answer some questions you might have. We'll go through some technical details. We try to keep it simple, but the reality is this is a very complicated conversation, so we'll get into the weeds at some point. That's why we brought back the slide deck to help you all follow along with the conversation, but you'll get a full slide deck with everything that you need to know to understand the budget reconciliation process and the impact on Medicaid and SNAP. So you can follow along with us today with our slide deck here from what Gordon's saying, what Signe's saying, what I'm saying, but in a day or two, actually usually in a day, you'll get the full slide deck, which you can use to inform yourself as you need. So as always, we'll have a Q&A portion, and there's some instructions in the chat as to how to use the Q&A. If you hear something you want to learn more about, just use the Q&A feature to chime in and let us know what your question is, and we'll get to it after the presentation portion. Okay, so we can get started. So before Gordon and Signe dive into the particular impacts on Medicaid and SNAP, I'm going to take a minute to walk us through the budget reconciliation process. This is just a level setting to make sure we're all on the same page when we talk about the budget reconciliation bill, that we all know what we're talking about. So just as a brief background, we're in the budget reconciliation process, which Congress is using to create a mega bill that's cutting taxes and incorporating various policies that are part of the current administration's agenda. So the budget reconciliation process is is important to note because it fast track cuts and it limits amendments and it blocks a filibuster. So everything's moving quickly. Every time we talk, we're updating you on what's happened just a few days ago. So things are moving very, very quickly, and that's because this is intentionally fast tracked. So the House and Senate have set a self-imposed deadline to pass this bill before the July 4th recess. So that's about next week. We've been raising the alarm around this deadline for the last few weeks, and now it's coming up on us. So you'll see how that impacts our call to action and the conversations that we're having on both the Medicaid and SNAP side. It's a very rushed timeline. We know that a few weeks ago, the House actually passed the One Big Beautiful Bill Act, which is its version of the budget reconciliation bill. It passed by very narrow margin, only by one vote. And the reason that's significant is it shows that there's a lot of disagreement around what should be in this bill. And that disagreement really comes from the conversations that we're having here. So the House passed its version and it's moved to the Senate. And over the last approximately 2 weeks, the Senate has been debating its own proposed version of the bill. So the Senate has largely been working on the bill in secret, and in the last week or so, we've learned a little bit about what the proposed changes to SNAP would be, what the proposed changes to Medicaid might be, and what the impacts might be from the Senate's version. So we'll hear more about this. I don't want to, I'll preview it a little bit, but we've learned recently that the Senate parliamentarian ruled that some of the provisions could not pass through the budget reconciliation process. So Signe will walk us through what obstacles the Senate has faced in implementing some changes to the SNAP program, what we can expect from those obstacles, and whether we can see some good news on the SNAP side. But just know that there have been some obstacles on the SNAP side of the bill as far as how it's moving through the Senate. This is not to say that the bill's trajectory is particularly slowed down. It's still moving pretty quickly. The Senate version is supposed to face a floor vote by the end of this week, or some even say maybe tomorrow, and it has a chance to be amended further during a marathon session on the floor. So if the Senate is unwilling to admit the House version as is, which that's what we're seeing some pretty significant changes between the Senate version and the House version. The process is that if there's too much of a difference between what the House put forward in its bill and what the Senate put forward, the Senate's version is going to go back to the House for approval. So that's kind of what we're watching for to see if that's going to be the result after the Senate vote. So we are in a situation where the Senate Majority Leader, John Thune, cannot afford to lose more than 3 Republican votes, or he won't be able to pass the bill in the Senate. So explaining that these bills are harmful to our state, the same way other advocates are, is creating the kind of disagreement that is making it harder for the bill to go through based on the truth, which is that it's harmful to Medicaid and SNAP, and which is harmful to Tennesseans. So really explaining that there's no good version of this bill is really significant, and that's what we see is skewing the vote in the voting process. So just to go back on the timetable, the administration is pushing, the President Trump is pushing this bill for the House and the Senate to resolve their differences and compromise their differences and get this bill to a vote by this week and get a full version finalized by July 4th. So we we understand that that's the timeline that we're working under. And so again, all of our conversation today will be focused on that framing and on that timeline and keeping you all informed about uh, how to create some obstacles to make sure that that doesn't happen. So any delays make it an issue for the bill to pass. Delays make it harder for both sides to agree. And of course, we use the opportunity to inform the public about what this bill actually does and who it actually harms. So if we can use these conversations to inform ourselves, inform others, it really brings everybody who needs to be a part of the conversation into the conversation. So again, thank you all for being here. That's the background. That's what we're working with. We're all working really hard over the next week or two. So we really, again, appreciate your time and your attention. And hopefully if you all have any questions of how to get involved, you'll share with us. But at this point, I'm going to turn it over to Gordon to dig into the Medicaid piece of everything I just shared. And then again, after that, we'll hear from Signe. Gordon, please go ahead.
Thank you, Jane, and thanks everybody for continuing to tune in for sort of the visual equivalent of doom scrolling. We're sorry to inflict this misery on you week after week, but that's kind of where we are. And I really want to share some positive developments. For the first time, I think we're getting through to our own congressional delegation. Folks have been very helpful in sharing the feedback they've gotten when they've reached out to our congressional delegation. And within the past 24 hours, a couple of significant turns. We know that Senator Marsha Blackburn her staff is now acknowledging to constituents when they call that she has some reservations about the Medicaid funding cuts in the bill and the impact on the state. And I think the hospitals in particular, we'll come back to this, but the hospitals in particular, the impact on them, which has always been a threat, but now they've been much more forthcoming. And we have a list of hospitals I'll get to in a moment that are particularly at threat. But the willingness of hospitals to speak out and really acknowledge what this can mean for their communities, I think is having an effect. So I know that we've been exhorting you all to keep the calls and emails going to our representatives and senators. And I know it's felt like you've been beating your head against a concrete wall, but in fact, it, along with the messaging from millions of other people, is beginning to have an impact. And it complicates the path to passage. So let me just give you the high points or low points, I should say. In the slides we've selected to show here, which are only a part, as Jane was saying, of the slides that we'll be sending you after this via email, are just contain some of the big numbers that it's hard to keep straight. I think the big message is that we're looking at 1.3 trillion reductions in state and federal funding for Medicaid over the next decade. That's trillion with a T. The Congressional Budget Office, the neutral, nonpartisan staff to Congress, has estimated that it will cost 11 million people their coverage. 7.8 will lose their Medicaid coverage. 3.2 will become uninsured as a result of refusal to extend expiring premium tax credits. It's going to have a really large impact on people who get their coverage through the Affordable Care Act. The Senate, we can't overemphasize the fact that this is a constantly shifting situation. The Senate is trying to reconcile conflicting viewpoints within the Republican caucus. You've got budget deficit hawks that are very unhappy about the fact that this is going to add $3.8 trillion to the national debt. And on the other hand, and so they're pushing for deeper cuts. And on the other hand, you've got so-called moderates, remains to be seen whether they are, who are concerned about the cuts that are being threatened to the health and nutrition programs. So that tug of war is going on, and the numbers that we're sharing with you now and the data we're sharing with you now is sort of as of the moment. I mean, I've been personally doom scrolling almost 24/7, trying to keep up with it. And I know that my colleagues have as well. So just want to emphasize that these numbers, while they're what we have at the moment, they're subject to change. We may not have the Congressional Budget Office scoring at all before there's a Senate vote. The Senate vote could start tonight, less likely, but certainly that's the effort. And the hurry to all of this is that the longer it hangs out there without a vote, the more the public learns about it. And the more the public learns about it, the less happy people are to know what it's going to actually do. Next slide, please. Next slide, please. I just want to really pause for a moment and talk about the impact on rural hospitals. That's beginning to really, I think, sink in. And the University of North Carolina at Chapel Hill has what's regarded as sort of the preeminent national repository of expertise on rural health. And they, in response to a request from some senators, updated a list of the hospitals that in every state, rural hospitals that they believe face the high likelihood of closing if these Medicaid cuts come through. And that's based on the fact that these are all hospitals that have lost money for the past 3 consecutive years. Plus, UNC has an economic model that they run to then pare that list down to really focus in on the ones that are most critically endangered, that they're already underwater, and the kinds of cuts that these Medicaid changes would inflict would really be difficult for them to survive. You'll notice that we put up here the representative, the congressional representative. As Jane was saying, the bill, once it clears the Senate, it's one thing that's clear, it's not going to be a carbon copy of the House version. So it must go back to the House. So the House of Representatives, those members that are even closer to their districts, because their districts are smaller. Obviously, the two senators represent all 95 counties, not so the representatives. And you'll notice this list of Republican representatives who all voted for the House version now are confronting a situation, whether they acknowledge it or not, in which another vote to sustain these kinds of cuts will have really dire impacts on identified communities. I would just note that some of these are associated with larger systems like St. Thomas or Vanderbilt. And those have somewhat better prospects, but the fact of the matter is that if they're on this list, they are a real financial drag on the larger health systems to which they belong. And you can't expect those systems to keep those facilities open indefinitely. So, and what you may see if they don't close them is that they close particularly costly services like obstetrics, which we know is already a huge problem across the state with rural hospitals that remain open but stop that service, which just means that mothers have to travel that much further from some communities in order to deliver their babies. And if it's a high-risk delivery, that has really grave implications for both the mother and her child. Next slide, please. The other big thing I want to emphasize is that is getting traction is the recognition from the delegation, or at least some members that are now acknowledging that they're concerned about the effect that this will have on the state budget. Our analysis shows that it will, excuse me, and it's been confirmed by others, that the current version of the bill would take $1.6 billion annually from TennCare and another upwards, depending upon a number of factors, as much as $500 million more from SNAP. So that's a $2 billion hit to the state budget. And just put that in context, we're probably all aware of the huge battle that's taken place over the past couple of years leading up to the adoption of Governor Lee's school voucher program, excuse me, and the allocation of $350 million in education funding to that program. If you take $2 billion from the state budget, there's no way that SNAP and TennCare are the only things going to be impacted. At that magnitude, the cuts ripple across the state budget and affect other aspects of funding as well. And so the area to be most watchful about is what will that do to school funding, particularly K through 12. That's the largest item in the state budget. And when you take the amount of money out that the feds are talking about taking now in the budget bill, it's going to wash over and affect everything from public employee salaries to school funding, on and on. So I think pushing on those two items is really salient these days with members of the congressional delegation. We really need to emphasize that because I think they're already nervous. One other item I just will throw in quickly, well, two items. One is that one evidence of their concern about the impact on rural hospitals and nursing homes and clinics is that they're now quickly trying to cobble together a $1 billion rescue fund providing directed aid to rural hospitals. Let me just say, I went to law school because I'm really weak on math and I didn't want to have to do math. So I'm not strong on this, but even I understand you can't take $1.3 trillion out of TennCare and then create, with all that that means for hospitals, including rural hospitals particularly, and then try to add back in $1 billion that you're going to spread across 2,000 rural hospitals in 50 states in the District of Columbia. So that just does not work. And we need to be clear that you can't put that kind of Band-Aid on a sucking chest wound and expect it to make up for the harm that's being done. The other thing I want to mention is just that I think has not gotten enough attention is the impact on nursing homes. The funding will impact nursing homes' financial viability, but apart from that, and we mentioned this before, but again, I think it's worth emphasizing. This bill strips out minimum staffing standards that are essential for the safety and health of people in nursing homes. And when I say people in nursing homes, I'm not just talking about those who comprise nearly 2/3 of every nursing home resident in the state whose care is paid for by TennCare. I'm talking about everyone because those standards apply to facilities that accept Medicaid or Medicare, whether or not a given individual in that nursing home is paying for their own care privately or is getting coverage through Medicaid. So those standards, which advocates have fought for literally 35 years, because I'm old enough to have been involved in those struggles for 35 years. We finally, last year, got the Biden administration to adopt widely endorsed standards to say, look, you cannot safely operate a nursing home if you don't have enough staff. And if you don't have enough staff of the relevant qualifications and criteria. And unfortunately, this bill, in a huge gift to the nursing home industry, strips those standards and leaves us with facilities operating without enough staff to keep the residents safe. I've just heard too many stories over my career of people dying of or being hospitalized in critical condition from nursing homes with dehydration for the simple reason that they could not reach water for themselves. And when they rang the call button, there was nobody there to respond. So if you think it doesn't matter if your mother or some other person that you care about who is in a nursing home is able to have someone there 24/7 to respond to their nursing needs, then this bill is fine. But if those things concern you, please share that with the members of our delegation. And with that, I'll turn it back to you, Jane.
Thank you, Gordon. That was really, really important information. So just to quickly recap, Gordon was highlighting the disagreement in the Senate, the impact on rural hospitals, which is critical, and on nursing homes, and of course the hit to the state budget. I'd like to just highlight there are a couple folks in the chat talking about the hospitals that we mentioned just a few slides before. Please take a minute when we send out the full slide deck to look through the letter that the Shep Center put together. Look at the hospitals that are listed as being at risk of closure and see if they're in your communities and really connect to, I think, the risk of rural hospital closures if you haven't already. That's really up-to-date information. It's really critical research that folks are doing to empower our work. And so I just wanted to make a plug for that and make sure you all take the time to review that letter. Signy, we're on deck to talk about SNAP, so it's over to you.
Hi, everybody. Thanks for being here with us today. I want to just take a minute and share some updates from SNAP. First, I wanted to go over just the general information that we've shared in the past, just to make sure that everybody has the background information. We are really concerned about what's in the reconciliation bill and the cuts to SNAP. It is the first line of defense against hunger. And a really important tool for assisting low-income Americans. And these are the largest cuts to the program that we have ever seen. The numbers are even higher than what are on this slide. I mean, we could see many more than 3.5 million people nationwide losing SNAP. I've seen even estimates up to 7 million who are at risk of losing benefits if this goes through. Jane mentioned at the top of the hour that the House and Senate versions are different. They are somewhat different, but they are both equally bad. In many cases, the Senate version is worse for the SNAP program. And so we are concerned about that. And some developments happened on Friday that were somewhat positive, but still not enough to outweigh the issues within the bill. And we can go to the next slide that talks about the most recent updates. Thank you. So it's been a bit of a roller coaster. Late on Friday, there were two provisions that were halted by chamber rules. And I think we've talked a little bit about this in past sessions, but there is something called the Byrd Rule that must be met in the Senate bill. And the Byrd Rule, in very simple terms, limits what can be included in the reconciliation legislation, and it excludes provisions that are considered budgetary. And so on Friday, it came out that there were two provisions that were SNAP related that were going to be pulled out of it. And that is the state cost share and also the eligibility for some immigrants, specifically refugees, asylees, individuals who have been trafficked. And so those two provisions did not meet the Byrd Rule, and the parliamentarian took them out. The parliamentarian doesn't necessarily share the reasons why, just very vaguely that it doesn't meet the budgetary standards that are required within the Byrd Rule. We were happy to see that these had come out because these are both problems with the Senate bill and the House bill. However, it quickly became understood that the Congress was working to find a way to put these back in. And as of yesterday, there was indication that the state cost share was revised enough to be added back into the bill, so much that there was a press release that said it was coming back in. But then again, by the end of the day, it said it was not official. But even last night, with that indication that it wasn't, that it was a false alarm, that the cost share was not back into the bill, Republicans and the parliamentarian are working together. So it's not really a question of if it's going to be back in the bill. We are concerned that this is likely to be back when it'll be back in the bill. So the state cost share, just for a reminder to folks, I think we can go to the next slide, and that just outlines those two provisions a little bit more. But the state cost share provision is the piece where states are now responsible to pay for a portion of the SNAP benefit. States have never paid for the benefit. It's always been from the federal government, and it's been 100% funded by federal funds to the states. And with the Senate version, states are with the highest payment error rates are expected to pay up to 15% of the SNAP benefit. And I've shared in our previous briefings that in 2024, The benefit amount that came to Tennessee families eligible for SNAP was 1.6 billion. So 15% of 6 billion could be what Tennessee would face if this were to go forward. And states being able to balance their budgets is always a concern. And to think that Tennessee is going to be able to find a way to fund this, we're very concerned about people losing their benefits if this is to move forward. But this is likely to come back into the bill, and we should be hearing about it any day now, or any hour for that matter. The second piece that got pulled from the Senate bill was the immigrant eligibility, and we've talked about this as well. It would end SNAP support for refugees, asylees, victims of work or sex trafficking. And this has always been a bipartisan supported piece of the SNAP program, where we believe that immigrants who are in the country lawfully have access to the SNAP program. And especially in this category, it's always been a bipartisan agreement here. And both the Senate and House bill were aimed to take this out. As of right now, it's out because the parliamentarian decided it does not meet the Byrd rule, and we haven't heard anything about that getting put back into the bill. But even with those pieces taken out, there's still so much more within the bill that is problematic to the program, the work requirements, the administrative cost share, taking out SNAP education funding. All of that remains in the bill. And so to Gordon's point earlier, to Jane's point, all the information sharing that folks have done have been really important to elevate this to our legislators and to be talking about what the immediate effects will be to individuals in our state. And on the next slide, I think is my last slide, I just wanted to share and drive the point home a little bit further about what Gordon was saying earlier about the direct and indirect impact. We are talking a lot about the direct impact to the individuals who are going to lose or will struggle to access the SNAP program. But beyond that, there are so many indirect consequences that will happen if these cuts move forward. Communities and businesses will all struggle and see the impacts of the cuts if this moves forward. Gordon had talked earlier about the burden on schools. We know that they will see even an increased burden in feeding kids. We'll actually see a lower rate of kids enrolled in school meals because of the way the SNAP program works. It helps to directly certify children into the school lunch program for free school meals. And with these cuts, we could see many kids lose access to the school lunch program and cause a lot of administrative burden for schools, as well as parents. In schools may lose funding. We will definitely see more demand on our food banks. We've talked a lot about our food banks in the last few calls, and when we finish up our remarks here, I'd love to hear from one of our food banks that are on the call, and we'll just hear a little bit more about that demand that they are seeing and already seeing because of the food insecurity that our families face across the state. And just the impact and the reduction to overall economic activity for grocers and small businesses is also immense. The other point that we brought up earlier too was the impact to rural communities. SNAP is used at a higher rate in rural communities, all rural communities. So a by-person percentage of participation is highest in our rural communities, and so our neighbors and folks in the rural communities will really feel the brunt of these cuts. And I think with that, that's my last slide, and happy to turn it back over to you, Jane. And I also want to hear from our our friends at Second Harvest Food Bank. Cecile Wimberly is on the line. Jane, I don't know if you want to jump on. I'm also happy to. I always love introducing Cecile Wimberly, who is the advocacy manager at the Second Harvest Food Bank of Northeast Tennessee.
Yeah, Signy, I think you just did it. Cecile, please jump right in. Thank you for being here.
Okay, great. Can you all hear me? I'm sorry. I'm not quite sure if you've got audio yet or not. So we serve the upper 8 counties in Tennessee, the most northern 8. And as you can imagine, we are very rural in nature and not a very urban population at all. And so for us, summer feeding, I just want to talk about it for a minute, has been very problematic over the years because of different federal guidelines about how we are supposed to feed children in our region. We've done everything at our food bank from taking school buses out to kids so that we can meet a congregate feeding requirement, to most recently starting to have a pantry site at our warehouse. That is very new for us. This summer, we decided to actually do a pantry at our warehouse location in Kingsport to allow families to come to us and get boxes of food for the kids. And as one can imagine, we expected there to be a need for those food boxes because, as we all know, the governor did not seek to utilize summer EBT in Tennessee, instead focusing on only 15 counties. So for our region that we serve, that meant only 2 of our counties even qualified for that summer EBT program that the governor implemented in his budget. So we knew we needed to fill a hole. And our summer feeding employees have gone above and beyond at our warehouse. But what they've been telling me is every week there are more people. They have not had a constant just line of the same, let's say 25 families. Now, every week, the number of families that are coming to pick up these food boxes is increasing. And the last time I talked to Emily, who's in charge of that program, she said the previous week, they were down and they had 2 families and they were able to scrape together food for 2 boxes. And they were forecasting to go ahead and try to get 50 more boxes ready because that's kind of the increasing need we're seeing every week. And that's just for the summer months. We know at our food bank that donations are down financially because with the issues in the economy, a lot of our longtime donors are concerned about what the end result is going to look like for them if they have a lot of things in retirement accounts and stocks. It is very volatile right now for individuals that are relying upon retirement. And a lot of our donors are very worried about what things look like for them financially. So we're seeing pressure from a donor side where we are not getting as many financial donations in. Obviously, a lot of you know, back in April, truckloads of food were cut for food banks across the state of Tennessee. For our particular food bank, it was sort of a mixed bag of about 17 trucks that really equated into 10 truckloads of food for 3 months. You can imagine what it's like to think you're getting trucks filled with protein and nutritious foods for families, and to find out that those trucks have been cut. We were told there might be some bonus 32 buys that we could participate in, that the state might partake of. But of course, those lists were things like apricots and nuts. That is not a trade-off with a truckload of chicken or pork or some other sort of very dense protein. And you can't feed a family on dried fruits like you can hardcore fruits and vegetables and proteins. So we're seeing it from a lot of different angles right now, and it's very concerning to us because with all the other cuts, not just projected cuts in a budget to SNAP, we have to be very concerned about, are there going to be potential cuts to TFAP? If they do not fund TFAP at its full dollar amount, obviously we cannot get as many truckloads of food into our food bank to help cover sort of these stop gaps. Ultimately, food banks are not supposed to be the primary source for families. We're supposed to be the emergency food source. And unfortunately, what we are seeing is because of our economic times and governmental decisions, we are becoming families' frontline food sources.
Cecile, thank you so much for that perspective from the food bank. We've talked a lot in these calls about how the pressure on food banks was already great, and any kind of impacts, negative impacts to SNAP program like cuts and disenrolling people will only put more pressure on the food banks. So your perspective is really, really essential, and I hope folks can use that as they, talk to folks, talk to their community, talk to our senators, and really share the particular impact of SNAP here in Tennessee. The donations are not coming as much as they used to, and there are more people in need. So we can't afford to cut SNAP. With that, I'm going to transition us over to the Q&A section. This has been a really, really insightful conversation so far with everything that, sorry, actually, before we get to the Q&A, can you go to the previous slide, please? I just wanted to take a minute to re-emphasize some things that Gordon has mentioned and Signy have mentioned. We want you all to continue to take action at this critical moment. We have the rest of this week and part of next week to push our senators as much as possible, and also push our House representatives as much as possible. We're at a critical point where we can really lean into any delays in the amendments, debates, negotiation, and ultimately voting process, and we want to take advantage of that. So we're going to encourage you all to focus on rural hospitals in your outreach and in your conversations right now. Let's get everyone to understand that there's a threat to the rural healthcare infrastructure here in Tennessee, and that should be front of mind for everyone who is in a position to represent Tennesseans. So we're again hoping that you will write a letter to your editor of a local paper, join a radio show, speak on a podcast, add it to a newsletter that's going out. Anywhere where the public can receive this information, please include it. Explain why this matters. Explain why we're focusing on rural communities here in Tennessee, where 30% of our state residents live in rural areas. That's hundreds of thousands of people that are potentially impacted on the Medicaid and SNAP side. We want to make sure that folks know which hospitals are impacted, and you all have that list now, or you will once the slides go out. Include that in your outreach and include it in your conversations. And again, when you do something, ask your friends, ask your relative, ask anyone who's around you to do the same. We're really in a position to, again, get the word out. We know it's working, and we don't want to slow down right now. So that's our call to action. There's, again, always more information in the slides that come out, especially sharing your story and things like that. And you can always kind of use that to navigate what action you'll take or your organization will take. With that, I'm going to move us to the Q&A section of the conversation. We have a couple of questions from folks, and I'm sure more will trickle in. Gordon, I've got a Medicaid question for you that I think you can speak to. It's related to the block granting threat that came down a few years ago. Someone's asking, did Tennessee accept a block grant for healthcare spend? And if so, how does this play into the current budget reconciliation process?
We got what was advertised as a block grant. Technically, it probably wasn't. And it was the first of its type in the country. Is granted at the end of the first Trump administration. We and our colleagues at the National Health Law Program filed suit in the District of Columbia, and that was withdrawn, I'm happy to say. So it really doesn't figure into the current bill at all. The idea of a block grant is that you say, instead of the way it operates now, which is the federal government matches the cost that states incur for Medicaid on an open-ended basis, is whatever the states end up having to spend to cover the medical needs of the people on the program, the federal government covers 2/3 of that. And under a block grant, that would be capped. So the good news is that, which, given the fact that healthcare inflation continues to make medical care more unaffordable each year to more and more people, the ability to keep pace with inflation is really critical. And so if you cap it the way it was proposed in the block grant, you mean that what that means is that eventually the program will just wither under the onslaught of inflation. The way that's relevant here, though, is that this doesn't cap the program, but it very insidiously limits the ability of the states to tax healthcare providers to keep up with the cost of the program. So it's another way of approaching the same thing. And that's where the $1.6 billion annually in costs, cost cuts to the state would come from. Because the way the bill is drafted, it would cost the state $1.6 billion that we now raise from provider taxes. It will have a serious, drastic impact on funding in many other states as well. So it's all a wrestling match to see how the federal government can somehow shift these costs to the state. The block grant was one way to do it. That's not here, but the feds are taking a different approach with the same effect, which is to say, well, we won't cap how much we contribute, but we will limit your ability to raise your share of the costs.
That's helpful, Gordon, and actually perfectly dovetails to the next question. I think it would be helpful for folks just to have you clearly restate the tail end of your answer to the previous question. We had someone asking, what aspects of the bill contribute to the $1.6 billion cuts to TennCare besides the provider tax changes? And it sounds like you can maybe respond to that.
Sure. When we did the math, we came up with $1.6 billion. Interestingly, Senator Tom Tillis, a Republican senator, a conservative Republican senator from North Carolina, has issued a statement identifying a number of states, including North Carolina, obviously, but also naming Tennessee, that will take a hit from the way the bill is currently written. And his statements, incidentally, are one of the reasons why I think it's significant that the kinds of calls that people have been making and the emails are having an effect. He's a very conservative Republican who has been a strong supporter of the president and this bill, but he is now concerned about the impact of the budget changes on the state budget and on hospitals specifically. He too used the figure 1.6 billion. That's just from the changes to provider taxes. We don't know how to price the other changes in the bill. The level of information in the Congressional Budget Office estimates about savings are just too general. They attribute a lot of the savings, $162 million, to just people losing their coverage because of the red tape. It adds to the red tape that people have to endure. And we know all about in Tennessee because we've seen TennCare use red tape to cut more than 400,000 people off the program over an 18-month period last year and the year before, by just 75% of them weren't found ineligible. They just couldn't complete the process to retain their coverage. Well, when you create a minefield of red tape and bureaucracy, and you require everybody to go through it, it's difficult to estimate in advance who it will trap, who it will cause to lose their coverage, and how much those savings to the federal government will translate into cost to the state. So we have not tried to price that, but it will be substantial. So when we say 1.6 billion, that's a low figure because it doesn't take into account these other changes.
Thank you, Gordon. So that 1.6 billion is what is the most accurate number we have right now, and it seems like it's what others are echoing, including some folks in Congress.
It is accurate, but I just want to emphasize it only prices one element of the bill. So it's it's accurate as to that piece, but it's not accurate as a total because total will be substantially larger. We just don't know how to price the other.
Great. Signy, I'm going to come to you for a SNAP question. We have someone who's wondering if we can explain how the SNAP work requirements in the bill differ from the work requirements already present here in Tennessee. I know you said that they're worse, but I think some folks want some detail.
Yeah, I'm happy to talk through that. So yes, work requirements already do exist in Tennessee. They are specifically targeted at individuals between the ages of 18 and 54. And they are targeted at adults without children and without dependents. So we have them, they exist. But we see lots of complications with the work requirements as they are. We will often work with clients who have been knocked off the program just because of the red tape and paperwork involved. They should still be eligible, they're meeting the work requirements, but either the caseworker has missed something or because of confusion, there's something that the client doesn't understand. And so work requirements cut people who are actually eligible off the program. And then the other piece of this is work requirements don't work. People who are working, who can work, are working. And for those who are struggling to find work, what they need in order to find work is food. If you are hungry, if you are struggling to meet your basic needs, it is going to be that much harder to find work. And there's lots of research out there that shows that work requirements do not improve employment across the state. So that's what I'd say to what exists already, and that our work was really trying to peel those back and make work requirements less. This ramps up with the work requirements, makes them more rigid, and now targets people with children. So now, if you have a child, the Senate bill is actually looking to make sure that both parents in the household, so if you're in a traditional household where you have two parents, it's expected that both parents meet work requirements. And if you don't, it could kick the entire household off of the SNAP program. And there's the Senate bill is looking to add families with children ages 10 to 18 would all be subject to work requirements. And they don't consider taking care of kids a work, and for many of us who have raised kids, it is work. It's unpaid work, but that is not considered work underneath these work requirements. So that's a huge problem with the Senate and the House version. The other piece to the Senate bill is that it expands it to include seniors, more seniors than are already included. It was extended a few years back up to age 54. The Senate bill is looking to extend it even more to age 65. So suddenly, folks who weren't required to work or who were maybe even retired are now would be expected under the Senate bill to find work. So a 60-year-old is supposed to head back out into the workforce. A 63-year-old, 64-year-old, up to 64 is expected to find work under this. And if they don't, their food benefits will be cut, will be taken from them. And the third piece of this, where I said earlier when we were talking that in some cases the Senate version is worse, the Senate version puts back it undoes the waivers that exist around veterans, houseless individuals, and children aging out of foster care. And it requires that all of those individuals be subject to the work requirement. So a couple years ago, under the previous reconciliation bill, it was solidified that those categories of individuals should be exempt of work requirements. The Senate takes that out. And so now veterans, children aging out of foster care, and houseless individuals must meet work requirements. So there's so many ways that they are really ratcheting up and making the work requirements rigid, much more rigid than they already are. And we see a lot of problems with the work requirement piece.
Helpful. Thank you, Signy. Gordon, I have two questions for you. Just one in the, okay, great, you just responded. So for folks who aren't following along in the chat, we just talked extensively about the $1.6 billion figure that TennCare is estimated to lose. But when we're talking about the budget reconciliation process and the harms of the bill, a lot of the conversation you'll see is extending over 10 years because the budget cuts are predicted to are planned to extend over a period of 10 years. So $1.6 billion in 1 year as a hit to an annual TennCare budget looks like 16 billion over 10 years. So I just wanted to clarify that in case you see different information floating around. We're talking about the same problem. Gordon, anything you'd like to add?
No, thank you. I think that gets it.
Great. We have one last question from someone who's wondering, essentially, there has been a lot of talk from President Trump about keeping Medicare safe, keeping Medicare protected. And I'm wondering, Gordon, have you seen anything that says that Medicare as a program won't be impacted? And then if not, can you speak to the related impacts on Medicare if there are cuts to the Medicaid program, because they are linked for some portion of the population?
Yeah, there is a significant number of people who are known as dual eligibles. They're eligible for Medicare because they are over 65 or they are disabled workers, but they're also eligible for Medicaid because of low income. And Medicaid plays a crucial role for those individuals in paying their Part B Medicare premiums, that is for their doctor coverage, their non-hospital coverage, and covering some of their drug costs, et cetera. Cuts to Medicaid will very much impact their ability to cover the costs that Medicare does not cover. And you have another group of people who are known as who are involved in what's known as the Medicare Savings Program, who don't qualify for Medicaid, but because they are just above poverty, Medicare pays some of their cost sharing and their premiums. If their premiums aren't paid, they will lose their Medicare coverage for physician office visits and basically ambulatory care. They will still have, in most cases, Part A coverage, which is hospitalization. But of course, the access to the hospital is through the doctor's office. And so there will be millions of Medicare beneficiaries who, because of these Medicaid changes, will still have Medicare, but their ability to access their Medicare benefits will be severely impacted. So it's not accurate to say that this bill does not harm Medicare beneficiaries. It will harm, and quite seriously, a whole lot of Medicare beneficiaries.
Thank you, Gordon. Can I give you both 30 seconds to share some closing thoughts before we wrap up? I would love to, I think folks would love to hear just your top line takeaways, what they should be doing right now. We've said quite a bit, but just give them the main.
Well, I just want to reemphasize, we really are having an impact, even in Tennessee. I know people are cynical about the impact on our congressional delegation, whose members have been very vociferous about supporting the president and supporting this bill. But we know now from feedback they're concerned about the impact, particularly on rural hospitals and rural communities, and we really need to double down on that message. So even if you have already called, please call again and say, I've read what Senator Tillis said. I've read what's coming out from our hospitals in Tennessee, that this is going to have an impact. And even if I don't live in a rural community, I drive through rural communities all the time. I don't want to be in an automobile accident and die because there's no hospital to take care of me or my loved ones. So that's the weak point that I would emphasize right now.
Yeah, and I'll just echo again what Gordon has said and what Jane has said. I thank all of you on this call for the calls that you've done and for what you've shared, because it is working. We were so close with the House bill, and there's still more to be done with the Senate bill. So everything that you have been doing, yeah, keep it up, and anything that we can do to support you. If there's information you need, if there's anything that you want us to elevate, let us know. We're happy to assist because we've it's been working and we just want to keep at it. So thank you. And we look forward to talking again next week.
All right, thank you everyone for joining us. So just to close out, you heard from Gordon and Signe. You'll get information in your emails soon. But please keep up with TJC, follow us on social media. In particular, think about how to share your story and the short stories of others who are doing who are in this work and who are benefiting from Medicaid and SNAP, so we can uplift them in these conversations as well. As always, we appreciate your time. We appreciate your involvement in this conversation, your participation, and we really look forward to convening again soon. So thank you all for joining us today.